We are here with Prince Immanuel ben Yehuda of the African Hebrew Development Agency, some may say association.
Start it again.
Okay, say it again?
Yes.
Okay.
Wait. I don't want you to lean forward. Just be natural. Just relax. Just relax. You just lay back. Just relax and look. Your chair. Okay? All right.
We are here with Prince Immanuel ben Yehuda of the African Hebrew Development Agency. Thank you for attending the conference this week at the ICD. Your thoughts were provoking. So let's get right into the topic here. You spoke a lot about sustainable regions for growth in Africa, primarily about food sources and how, organic farms can, supplement, not necessarily supplement, but fuel entire communities. But you didn't necessarily, you talked about sustainable economies, but how do those communities that are they fuel their own food, they've got themselves taken care of, but how does that relate then into their economies? In terms of the sector there, do they create more than they need?
Well, that's a good question, but one of the things I think it's important to note about that is that, specifically as we were talking about organic agriculture, even if you're producing more than you need or even more than you can practically sell, you're still producing the highest quality of food to service your population, to service your people. And that, I think, is a very important point, and for something that any responsible leader would look for, to ensure that his people has access to the highest qualities of foods and nutrition in order that they might be healthy, productive, and then able to create wealth even in other areas of endeavor. Because if they're not healthy, if they're only consuming that which is substandard or not actually nutritionally viable, then even if they consume a lot of it, they find themselves in a problem. I mean, one of the problems in developing Africa right now, you have undernutrition, which is not lack of food, it's you're eating the wrong food. Malnutrition is not having enough nutrients, but undernutrition is because people are eating a lot of the wrong things. Well, this eliminates that problem and therefore also contributes to the prevention of disease and allows for your population to be healthy, viable, active. So it's even if it's not more than you can sell, you still have a very significant benefit because you're healthy and you're able then to pursue other realms of endeavor in terms of economic activity to be generated.
You spoke largely about sustaining these communities and that health is number one. Health should be number one because if you can't keep your community members healthy, what do you have? You have, people who are malnourished.
Right.
What do you say to leaders, governmental officials who really don't have the best interests of the people? So maybe it's not their goal to keep the people healthy, but rather as laborers.
Well, and it's important for us, the populace, to begin to identify new characteristics that we're looking for in our leaders. Because someone like that, we certainly don't want to identify or recognize as truly a leader who has the best interests of his people at heart. So we're looking for those in establishing a new criteria for leadership, a new measuring rod for leadership. One of the things we talked about here was in the face of development models which have not served the long-term interests of development in terms of Africa in particular, developing new models and being prepared to say we're not going to do that anymore, and we can't promise everybody more next year, more next year, more next year when we're dealing with some very finite resources and whatnot. Who has the wherewithal to have that kind of character and integrity to tell the people this is the way we need to go? We understand, we're not naive, we understand the realities of getting elected and all these kinds of things that play into some of the dynamics of acquiring and attaining leadership these days. But when we're looking to secure our future, we have to begin to look at entirely new different development models and also new criteria for identifying and supporting our leaders. One of the things I think is extremely important is servitude from the leadership. Certainly the followers have their responsibilities in terms of staying true to the plan and to the vision and living up to their responsibilities. but leaders in terms of being an enterprise where one takes advantage of the population, that's not what we're looking for. We're talking about servitude as a matter of character and a matter of principle and a matter of commitment on the part of the leader to measure his progress with the state of his people. That a leader whose position is here, he establishes or attains a great deal of wealth individually, he might be recognized as a rich person or a wealthy person, but his people, if they're not also in that same condition, he can't possibly be recognized as a great leader. We're looking at those who elevate the condition of themselves and their people, and that comes through a position of the characteristic of servitude, and that's what we're looking for. And when we talk about servitude, we're not just talking about an act of kindness or a random, good deed. We're talking about it as a character and a principle by which one governs, leads, and gives of himself as a matter of conviction.
Let's just ask him this question. Ask him why he came here.
What?
Wait. Because, we can come back
And we can
voice
edit this.
And voice over, because if you stumble, it's okay.
So, we good?
Yeah.
What was your goal in reaching the audience here? What was the message you wanted to convey?
Well, first of all, I was excited to come here when I heard about the organization, the Institute for Cultural Diplomacy. I thought it was a very intriguing name, and obviously it took into consideration some things that are often overlooked in terms of the actualization of diplomacy in terms of culture. But also in the topic of the conference was the rise of Africa. And I'm very much committed to the principle of the rising of Africa. One of the things that I mentioned in sharing with the Youth Leadership Forum that took place before this particular phase of the conference was that my hope was in them, because I realized that we have a great opportunity. Many people are raised with the idea that Africa is primitive or backwards or left behind in terms of underdeveloped. I see that we have an opportunity to develop Africa correctly. What am I saying? I'm saying that the development procedures that have been implemented in the past have not benefited Africa, and they have not worked for even the countries that have implemented them and have championed them. So we have an opportunity to learn from those errors and to craft new systems, new ways of developing, which are holistic in their approach, comprehensive in their respect for the social nature, the cultural nature, and of course the environment in which we depend upon to live. When we approach it with those ways, we can make Africa the model for the future for other nations to follow. Preventive health instead of simply curative health is what I'm talking about. That we have a population which is committed to a way of life, a way of eating, and a way of behaving that prevents illness from setting in the first place. So now we're not worried about overburdening the already overburdened healthcare infrastructure. And we're not celebrating the building of a new hospital as means of progress. That means more sick people. So instead now, we're looking at reducing the need for hospitals and clinics, and that be a sign of our progress in the future.
So your step is, say now you went into Ghana. Yes. So you went into Ghana, and what occurred? Because you obviously dealt with lingering health issues that were already there. But then, what's the time where you turn the corner there and you say, all right, we're going to shift now just from maintenance to elevating people's health.
Right.
Where does that corner? What's that corner?
That's a great question. Normally these things are measured in terms of years, and instead of months or weeks. But you begin to notice the changes in many different ways, not just the statistical data in terms of an improvement in the mother and child mortality rate at times of birth or whatnot, but you begin to see changes in the society. You start seeing different menu options added because they're becoming more popular in the populace in terms of plant-based foods and whatnot. You start seeing advertisements to that effect. You start seeing billboards which continue to advocate the drinking of more water, the eating of locally grown fruits and vegetables, and that you start looking at business people who are looking to begin to stock their businesses with these other products and seeking them out in terms of, which demonstrates a change in the direction of the thinking of the people that they're serving. And we see that taking place in people's workplaces, in the churches, in the mosques, in the synagogues, but also in the street, at home. Mothers are shopping different. Children are coming home asking for different choices in their homes. And all these things make a difference. So you measure your change in a number of different indicators, all of which are significant.
Water's key.
Yes.
Obviously.
Yes.
And we spoke about trade versus aid this last week. Trade versus aid. How do you think aid, in terms of your program, or ideology, is best utilized? Would it be for water infrastructures, or, what other venues, in terms of aid, can help your ideology?
I think certainly water is a good place to start, being so essential. And then in terms of certain inputs, in terms of jump-starting the agricultural process, those are very good. And infrastructural development, those are very good. Certainly we're very careful not to create a situation where a populace becomes dependent upon aid and are not productive. No, we're looking to use it as an inducement, I think was the word that Sir James used, to inspire the community to be active and have the wherewithal, the essential elements within their grasp to be productive. That's the kind of aid we're looking for. And then beyond that, build upon trade. Now, we also are very clear about some of the dynamics which are at play and which influence in terms of the vagaries and changes within the global economic structure, which play havoc sometimes with trade and trade policy. But at the same time, if we make as our cornerstone producing those things that we know our population needs to survive and survive with dignity, honor, and good health, then we've already built the kind of elements to weather whatever storms or changes that might take place in terms of the economic order. And we're able to then make changes ourselves because we are healthy and capable of changing to these times and circumstances. Also, we know that there are others who have benefited from the current economic disorder and had privileged positions and whatnot. But this causes us to, in our selection of new leaders and the things that they negotiate on our behalf, negotiate with another level of strength. And we're not putting them under pressure to simply secure wealth, but they're looking to secure our health. So there's a whole other set of criteria brought into the negotiating process to secure the infrastructural things that we'll need to ensure our future from now into perpetuity.
All right. I guess we'll wrap this up. But I guess who's on the horizon? Who do you see going in terms of the African continent, but perhaps elsewhere, Latin America, South America? Who's on the rise? Who is using this concept to better the health of their communities?
I think it's a very good question. Of course, I want to cite the nation of Ghana, which has made preventive medicine and preventive health care their national policy objective. And so they're the first of its kind. No other country has made that their national objective or their national policy. We've had inquiries and visitations to Kenya and Benin and done seminars in these places. We've hosted delegations of the medical staff from South Africa and the city of Johannesburg, from South America, and also from directors of city policies in Chicago in the United States, and also from the city of Berkeley in California. So we see that the word is spreading, so to speak, and we're encouraged by that. We continue to create different mechanisms to allow for a different manner of becoming engaged or involved. And so we're encouraged about the future in that respect.
Thank you very much, and thank you for joining us this week.
Thank you.